Hi, my name is Dr. Christopher Lowe, and I'm one of the oculofacial plastic surgeons here at Eyesthetica. If you're watching this video, we likely had surgery earlier today, and I wanted to start off by thanking you for putting your trust in me and our team. Now, I understand this process may be new and unfamiliar to you, and so our team put together this video to answer some questions that might come up along the way. First, we're going to talk about things that you can commonly expect to see after the procedure. Now, blurry vision and even sometimes doubled vision is commonly seen. You will see some bruising and swelling that often gets worse for the first few days right after the procedure, and then will slowly get better as the recovery period continues. Your eyes may feel dry and gritty after the procedure, and it's often common for there to be some discomfort or mild pain around the surgical site. There can sometimes be some bleeding or some blood-tinged tears. All this is normal. Now we're going to talk about something that I am concerned about. If there's a little bit of bleeding externally, I'm usually not too concerned. However, if there's bleeding behind the eye and it's pushing the eye forward so that it's rock hard, there's loss of vision, lots of pressure and severe pain, I want you to call the office immediately for our on-call staff to triage. Now we're going to talk about some post-op tips and tricks. Starting with using the medication. You've likely been prescribed an ointment which we will start putting over the incision sites and in the corners of the eye. You just apply a small amount, like 1 to 2 grains of rice, over the incisions, and you can even put a little bit in the corner of the eye so that it gets over the ocular surface. Now, the ointment can get in the eye and it does make the vision a little bit blurry. During this time, if there's dryness or if you feel like the blurriness is intolerable, you can use some artificial tears to lubricate the eye. These artificial tears are available over the counter. Now, if you have some mild pain or discomfort, you can start with ice or Tylenol. Tylenol is available over the counter. You may have been prescribed a stronger pain medication, and that can be used as directed. So the most important thing for you to do after the procedure for the first 2 to 3 days is to ice regularly. I want you to use a cold compress for 20 minutes on and then 20 minutes rest, at least once an hour while you're awake. You can use a cold wet washcloth and put that in the freezer. You can also use a baggie and fill it with some frozen peas or frozen corn. You may notice a little bit of bleeding around the incision sites or even some blood clots around the lash line. I recommend that you leave that alone. You don't need to clean that area, no rubbing or scrubbing, as this can cause you to bleed or ooze a little bit more. Now finally, when you're sleeping, try to sleep on your back with the head of the bed elevated with 2 pillows. This helps to limit some of the swelling that sets in overnight. For the first week after the procedure, no heavy lifting, bending, or strenuous exercise. I want you to rest and relax during this time. And when you are sleeping, I would like you to use 2 pillows to elevate the head of the bed, as this helps to limit some of the swelling that sets in overnight. Thank you for your attention and for putting your faith in our team. If there are any questions that come up that we didn't address in this video, please feel free to call our office anytime. Rest up, and we'll see you in the office soon.